Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about what you should know working remotely as a medical coder or a CDI, Clinical Documentation Improvement. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got a comment on a video that I did a few months ago talking about nurses going from nursing to CDI. And the comment was, do you find that nurses get into CDI to work remotely? And I said no as my comment. And then another person commented, which is what brought the comment back today. And they said, is this for coding or for CDI that you're saying no? Because I've seen it both ways where people say, yes, you can work remotely, and others, so what's the deal? It's so confusing. There's so much information out there. Here's the thing. I will say this. I responded that, and pretty much this is going to be an extended response in this video, but I responded that medical coders and CDI do two different things. What's being pushed out there and romanticized by the schools, by people selling programs, is the idea that, oh, you get to work at home, or you, heaven forbid, they tell you, oh, you can travel around and you can work wherever you want to. You want to get a laptop and work at the beach, you can do that. There's a lot of things that go into this, but first and foremost, it is about privacy and security of patient information. When you start trying to connect to Wi-Fi willy-nilly, now you are exposing all of that information to, it is making it vulnerable. So this is what I'm telling you guys. On my channel, what I say is meant to support the medical coder, the CDI, the health information individual who wants to be successful in this field. This is what my channel is for. I am not trying to sell a program where, I'm trying to recruit all these people to get in there. Yes, I do have services, resume rewrites, coaching, professional coaching, tutoring. I do all of that, yes. But I'm not sitting here trying to hawk that every single time. And I'm not sitting here trying to push people to get a bunch of unnecessary credentials that they don't even need when they only need one. And it's important to know that there's a difference between being a medical coder and being a CDI. Now, being a medical coder means that you are looking at physician documentation, whoever, physician, nurse practitioner, PA, just whoever the privileged provider is. You're looking at their documentation, you're abstracting sometimes, which means you're selecting diagnosis codes. Sometimes the codes are already selected and you're just sort of auditing to make sure that they are correct. And then you are selecting the correct procedure, any modifiers, any E&Ms that go on these encounters. If you're doing outpatient side, if you're doing the inpatient side, you're looking at ICD-10 PCS and all that good stuff. So you're doing this, and then you're submitting it on to the insurance company or whoever does the billing and that kind of thing. So that's medical coding. Do medical coders work remotely? Yes, they do. Because during the pandemic, when the pandemic started, there was a need to have everybody at their homes. So yes, the work was remote because we were in a pandemic, right? And so we had to kind of work with what we had. Before the pandemic, if you were a medical coder, brand new, you were not allowed to work at home. It was going to be a very hard climb for you to get to work at home because you needed to have 3 to 5 years experience. And the reason that you need to have so much experience before working at home is because when you are at home, you are by yourself. And you're going to have to learn this new electronic medical record. You're going to have questions because book coding and real world coding are two different things. And that's what people need to understand. You may be a good student, but when you get out into the real world, it's going to depend on a lot of things. It's going to depend on the provider, their attitude, their education, their exposure to other medical coders. And did another medical coder ruin them where you're going to have to work extra hard with those providers? Because I have had some where I've had to really work with them because they do not trust coders because of terrible experiences that they've had. But thankfully, I was able to work with them. But that was me going above and beyond working on my communication skills so that they knew that I was there to be a teammate and to be their partner, not to be somebody that they tell what to do, because that's not the way that it is. We as medical coders know the rules, we know the regulations, and our job is to help them to make sure the documentation is complete and to make sure that everything is correct. That is our job. Can you do this remotely? Yes, but if you are a brand new medical coder, this is not recommended. I will never recommend this for brand new medical coders to work immediately at home. Some people had to do it in the pandemic, and I understand that. That's something that's completely different. But if you are out there and this is exactly what you want, this is why you want to do this, and you immediately want to work at home without having somebody at a facility training you first. I even say that even if you get training for a few weeks and then you go home, that's still better than you immediately working at home. Because to immediately work at home, you're taking on a lot of more things that you have to learn. Not just, okay, coding in the real world. Now you have to pay attention to the insurance company that you have to work with when it comes to, okay, this person has Medicare, this person has some other commercial insurances. So the codes may be different when you're doing certain procedures. That's something that you're going to learn when you're out in the real world. And it helps brand new medical coders to be there with people who have experience and who can mentor you and help you. That's why I say that if you're brand new, at least try to work at the facility before you attempt working at home. That's all that I'm saying. I'm not saying that you can't do it. I'm just saying that it would be better and more beneficial for you if you were working at a place first, then you get to go home, okay? Now that's a medical coder side, all right? So we're clear on that. Now I'm talking about CDIs. A clinical documentation improvement or clinical documentation integrity, people call it different things. They are the ones who are responsible for looking at the documentation and seeing where there's holes. And what they do is they provide education to providers. Now, coders can do this, yes, but with CDIs, they have, sometimes they have a little bit more advanced knowledge. Like that's why you see nurses doing it, because nurses can look at those clinical indicators where a medical coder may not understand what it means to have elevated glucose. That doesn't mean anything, right? But a nurse can see, okay, well, there's something that's missing here. They ordered this test, that test, and they did this and they did that, but where's the documentation? A nurse can see that. Now, a veteran coder can see it too, if they take the time to educate themselves and learn. That's what I have done. I have no medical background, but prior to being a medical coder, I have no medical background at all. But I have taken these 13, 14 years that I've been in as a veteran medical coder, and I've taken this time to read the New England Journal of Medicine on my downtime. I go to conferences. I take the time to do my research when it comes to my specific specialty. So it has made me more sharper when it comes to the coding. And when it comes to like, oh, okay, there's something missing here. And that's when I can query the provider. And that's when I educate the provider and I work with my providers. That's what a CDI person does. They look for those holes to make the documentation better. Now, CDI is something that has come about recently. It's been within the last 15, 20 years that it's really started to come out. But it's been a slow process. But there's more and more people doing it now because some places do see the value in having a CDI. However, being a CDI means that you're going to be even more hands-on with the providers. Now, coders can do this. Yes, again, they can work with providers, and they should. I will always say that they should, because not everybody has a CDI in their place, in their facility. But sometimes facilities are like, you know what, we just want the coders to code, and we want one person to do our education, one person to query the provider, one person to work with the providers and the coders, so that there's that in-between person, and it's not too many people telling them what to do. It's one person they can rely on. That's going to be our CDI or the CDI team to be able to work with those providers. That's what CDIs do. Now, should CDIs work remotely? Now, here's the thing, guys. A lot of people can get upset with me when I say this. I say that it's not a good idea because providers, and this was a hard lesson that I had to learn. This is me saying that I had a hard lesson I learned from a provider about this. When I was doing any kind of queries, any kind of education, I was doing it through email. Well, lo and behold, I find out, and I've said the story many times, but I'm going to make it short. This provider did not like emails. And in turn, I found out that there's a lot of providers that don't like emails, and it's very easy for them to ignore emails. And I also saw it when it was a pandemic and I was trying to send them emails, and then they started to ignore my emails. And I'm like, well, wait a second, fellas. I need to get a response from everybody because I need to know that you all are getting this information. And they're like, well, you're not here. Oh, so I'm not there. So y'all think it's okay to not respond to emails. Well, they started to respond to emails after that. But the thing is, if you are not there, it is very easy for them to ignore you. If you want to get into CDI, to use your knowledge, this is something that, yes, you need to be in the facility so that you can work one-on-one with those providers. They have access to you because sometimes they will not seek you out. But there are those that will come to you and say, hey, I need some help. There are some that are like that, but not all. So it's a very special provider that will do that. And I love providers like that will reach out and say, hey, I do need help. But it's also on the individual to make themselves available, to say, hey, I'm available if you need help. Okay? So should CDIs work remotely? No, you need to be in the facility. And now somebody's going to disagree with me. I really don't care, guys. What I'm telling you is supposed to help you to be successful. Yes, there's probably the CDIs that do work remotely, and they're totally successful because their providers have been conditioned and they work with them and they're okay with email. But that is a very almost rare instance. You're going to have providers who will not do anything when it comes to email. They will not pay attention to email. They don't care what you send them. They're going to do it their way. But if you are actually there and in person, it makes it more difficult for them to say, well, I'm not going to do what they say, because now they know you. So that's something to help set you up for success. The only things that I say on here, again, on my channel, on Medical Coding with Blue, are to benefit the individual. There's going to be a lot of people that say, well, no, I want it this way and I want it that way. Well, by all means, do whatever it is that you want to do. What I say again here is so that you're not blindsided when you get out in the real world thinking that, oh yeah, I can do all these things, when in actuality, the real situation is this. You need to be at the facility if you're a CDI. Because I told that individual who commented that, well, I see it both ways. And I said, what are you going to do if you're a CDI? Send emails all day? You need to be there and in person doing education. Well, Blue, they can do it over Zoom. They can. But there's something that's different being over Zoom versus being in person with the person. And you'll see providers start to open up a lot more when they have those individuals in front of them. And no, I don't believe in everything needs to be so sterile anymore, as far as like, oh, everything needs to be remote and we don't need to be doing in-person things. I think it's important because I think a lot of us are losing our people skills. People are losing their people skills, and that's not good, folks. That's not good. It's very hard on humans, right? Humans as a whole. When we start losing our ability to be able to connect in person and our ability to be able to connect with each other in speaking, right? Because remember, like when I was a kid, we called each other on the phone, we talked. There was none of this text messaging with all these stupid hieroglyphics that they have, you know? I don't like text messaging. I hate it. I hate text messaging. I would rather talk to people, right? Than to be text messaging, right? And so that's the thing, guys. We're slowly, falling apart as far as like, not being able to make those human connections because everything is over the internet or over Zoom or over, Google Meet or whatever. So that's the thing. What I'm saying is this. This health information, medical coding, CDI, is too important to leave to just being all, I never see them. They're always remote. It's too important for that, guys. It's too important to build those relationships. And I get people who message me all the time and say, well, Blue, that's not why I wanted to get into medical coding. I don't want to build relationships with providers. So you mean to say that when you are looking at somebody's documentation and you have no idea what that person is like or how they document or their habits or their mannerisms, you think that you're getting all the appropriate codes that you can get out of that documentation based on what they have there? What if there's something that's missing? How do you know unless you're talking to them? I've had providers tell me, well, we don't get credit for that anyway. How do you know you don't get credit? Who told you don't get credit? And even though you think it's minor, how do you know that you can't get credit for it? And see, that's the thing right there. I've had providers who the patient's in the global period, right? So all those visits are covered, right? For that particular condition. But this patient had another condition that they had to work up additional workup for. Well, when I saw that there was all these orders and everything else, but there was nothing else, I was like, what's going on here? Oh, well, they had this condition happen, right? I don't want to go into too much detail. They had this thing happen, and that's why all this stuff is ordered, and all this, pharmacy and everything else. Where's the documentation? Well, we don't get credit for it anyway. This is completely separate from the surgery. Oh, well, I thought it was anything that was in that time that it doesn't count. No. There has to be a reason why you're ordering all these things, right? So tell me why. What is it, So we learned something that day. But it's about paying attention and about being right there and about saying, okay, let's communicate, let's talk this out. Because a lot of people are trying to run around finding all these other ways of being efficient when it's just as easy to talk to the person rather than just trying to do this all over email. How are you supposed to educate as a CDI over email? Because believe me, I have seen many a CDI folk who they hate writing, and you can clearly tell that they hate writing, and they're trying to send this advice by email, and then it doesn't make sense, and then the providers are like, what are they saying? So that's again where we have to work on communication. It has to be good verbal communication, good written communication. But let's try not to always romanticize the fact that, oh, I want to work remotely, or I want to do this remotely because that's the way that I want it. There's a ton of things that you guys can do that is remote. There's a lot of things there's sales you can do remotely. There's all these other things. It doesn't have to be health information. It doesn't have to be medical coding or CDI. Because trust me, medical coding and CDI are expensive enough to get into. Think about what you're investing in. Right? It's a fantastic career. It is life-changing, because I will say that. It has changed my life. I got into medical coding without even knowing what it was, because this was a gift. I was going through a program that paid for this. Through the state, they paid for it. And the Workforce Innovation and Opportunity Act, the WIOA it is now, right? So I went through them, and they said the only thing you have to do is get a job in the field that you were trained in. And did they tell me that I could work remotely back then? Yes, they did. But I said, no, why would I want to do that? That sounds great, but why would I want to do that when I don't really understand all the stuff yet? I need to be in a place first. And I have worked remotely twice. And they were good experiences, but the last one, the second one was a pandemic, and I will never do that again. I will never do that. I was at home for 5 miserable months, and I couldn't stand it because I had evolved so much working that being with my providers was very important, and I saw the value in being there. Okay, so that's just something that you all ought to know. Before you get into this and before you think this is going to be the greatest thing in the world, it's not just you. Especially if you're a CDI. It is not just you. It is your providers too. And you have to think about what is best for them. how are you best able to serve their needs as far as education goes, and helping them to get better documentation so that the coders have something good to work with. Because if the coders are sitting here going back and forth with the provider, rather than have somebody that's a CDI say, okay, no, it's this way. Guys, think about that. And consider all of those things before you start getting into it. And this is why you want to do this is why you want to do that. It's not all about the romantic side, guys. It's not the romance of you get to work at home, you get to be in your own private bubble, and you get to not have to deal with any drama. Oh, trust me. Trust me, the drama, if you think you're going to escape office drama, office politics, you're wrong. Because even working remotely, oh, trust me, I was privy to quite a few meetings when I worked for a level 1 trauma hospital. And there was a lot of behind the scenes bickering going on, and it was very drama filled. So again, you don't escape the drama being, virtual or even online or remote. You don't escape the drama. It never leaves, guys. What will help us and what will improve with time is if we all start to work on communication skills, if we all start to be upfront with what we do, if we start to study harder for this field. There's a lot of people that come into this field and they say, well, my trainer didn't train me on that. It's not up to your trainer. That's not an excuse. That will never be an excuse, because ignorance of the coding rules, ignorance of the disease process, ignorance of the procedure codes and everything else is never an excuse for why you didn't select the correct code. We have to continue to study. If you don't understand something, you have to make a way for yourself to okay, now I get it. You either hire a mentor or not hire a mentor, because mentors don't get hired. Find a mentor or hire a tutor, one of the two, guys. So that way you can get out there and really start to dig in and figure it out. I did that when I was 6 years in. It finally clicked that I didn't know everything that I thought I knew. And it wasn't until I had that aha moment, I'm like, now I get it. Now I understand. So that's the thing. And you have to get there on your own. You have to make that decision and go with it. That's all I'm going to say on that. But yes, the short answer to CDI and to medical coding is yes, you can work remotely. The long answer is that if you're brand new, don't try it, because you're going to miss out on a lot being in person first. It stunts your growth if you don't know all of these things, right? And again, you want to be able to grow as much as you possibly can, because this career is a career. It's not a job. There's a lot of people that see it as a job, but it's not a job, guys. If you take it seriously, it will reward you, but you got to take it seriously. And that's all I'm going to say. So I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.